So before we introduce our next keynote speaker, I'd like to just take this moment to remember Dr. Justin Singer, who was a remarkable neurosurgeon, husband, and father of four, whose sudden passing last year in October at the age of 42 was a blow to those who knew him. For those of you here who didn't get a chance to meet Justin, who is very passionate about the SSG, very passionate about subcortical surgery, you all would have liked him. He was a warm, generous, fun-loving, bombastic type person who just lit up the room every time he entered, not the least of which due to his loud and unforgettable sartorial choices. As Director of Vascular and Endovascular Surgery at Corewell Health in Grand Rapids, Justin combined clinical excellence with relentless innovation, leading his community in advances for stroke care and endovascular surgery. But it was the way that he cared for people, not just their diagnoses, that defined him. Sir William Osler famously stated that a good physician treats the disease, but a great physician treats the patient who has the disease. And by this metric, Justin was, without a doubt, a great physician. He brought empathy and presence and humanity to every encounter, treating each patient as if they were family, and in turn they loved him for it. This memorial lecture series was established to honor not just what Justin accomplished, but how he lived, with curiosity and generosity and compassion. And I'd like to think that today's speaker would agree that Justin knew how to have a fun life in neurosurgery. It is my honor to welcome today's keynote speaker, Dr. Joseph Maroon, clinical professor and vice chair of neurosurgery at UPMC, longstanding team neurosurgeon for the Steelers, and a distinguished leader in brain health, performance, and the lifelong pursuit of balance and meaning. Dr. Maroon has authored over 300 peer-reviewed publications, 40 book chapters, and multiple books, the favorite of which of mine is How Red Wine Activates the Genes for a Longer and Healthier Life. Remarkably, Joe's completed more triathlons in the years that he's been alive, an especially impressive feat considering that he didn't run his first race until well past midlife. Dr. Maroon's lecture today, Success, Failure, Creativity, and the Secret to a Balanced and Fun Life in Neurosurgery, invites us to reflect on what it means to build a life, and not just a career, in our demanding and rewarding field. Please join me in welcoming Dr. Maroon.
Well, good afternoon, ladies and gentlemen. It's a distinct pleasure and honor to address you this afternoon. And in my many decades of attending neurosurgical meetings, I want to specifically compliment Dr. Bales and Dr. Jha and also Dr. Kassam in really one of the most innovative, creative meetings in terms of the individuals who have presented that I've attended in my 5 decades of neurosurgery. So really, it's outstanding work, and it is, as Amin said earlier, this is probably the most exciting time in medicine, and in particular neuroscience. So when Julian invited me to give this talk, he asked me, he said, "Joe, what would you like to share with the audience, given your experience over 50 years?" And it reminded me of a ceremony they have at Carnegie Mellon University in Pittsburgh, our sister institution, in which every year, towards the end of the calendar year, they select a particular distinguished professor, and they tell him to contemplate his demise and then present a last lecture. What is it he would share with the audience if it were to be his last lecture? And it's so ironic when we're talking about Justin Singer at 42 years of age, who died, and knowing none of us know the hour nor the day when we'll be called. So I'm very sensitive to this message. And when Randy Pausch was asked to become the lecturer that year, he didn't know at the time that he had pancreatic cancer and would be dead within about 8 to 10 months. But he subsequently did give the lecture, and he talked about the importance of overcoming obstacles, enabling the dreams of others, mentors, as many of us are. When connected to others like this audience, we become better ourselves, and most importantly, carpe diem, seize the day. So another book I recently read, I asked myself, how am I on this stage? Why am I here? How did I get here? And basically, nothing we do is a fluke. Inconsequential actions have life-changing consequences because of the connectivity in our lives. I had no idea in 1989, when I was chair of neurosurgery at Allegheny Health Network, and I was looking for a vascular surgeon, that I would find this young buck from Barrow Neurological and Northwestern University who would join me at the Allegheny General Hospital. And subsequently, the reason I'm here is because of that fluke. It wasn't a fluke, Julian, that happened. This morning, we heard one of the speakers talk. In fact, it was the Morgan Stanley woman, Yaz, who talked about where we come from, who we are. We're all a part of everything we've met and we've done. I grew up in Bridgeport, Ohio, on the Ohio River, 3,000 people, 5 bars and 35 dogs. You had 3 choices. You either worked in the steel mills, the coal mines, or got an athletic scholarship. I was fortunate to play baseball with the American Legion Post 227 with John Havlicek and Phil Necro, none of whom you may have heard about, but both are in the Hall of Fame for the Boston Celtics and the Atlanta Braves. And I, believe it or not, was the chief threat. I was 250 pounds and 6'6" when I played football for Indiana. And this is what happened to me. But even Woody Hayes, I put a little fear in Woody Hayes. And I show this picture because this is another, not a fluke. I was playing against the University of Minnesota when this linebacker was hanging on my helmet, and I was knocked into the stadium steps or stands with a concussion, a neck injury. I had no idea that injury would subsequently lead to my career in sports medicine, my position with the Steelers, and et cetera. And also recruiting Dr. Bales to be a team doctor for the Steelers, and all of his many contributions that came from that hit against the University of Minnesota. I'm going to try to be as succinct as I can. I'm going to talk about life, and I'm also going to talk about science. And the life, success, failure, burnout, and the secret to a balanced life. And then I'm going to talk about the things I'm really interested in now and why I'm having more fun at this part of my career in no longer the fourth quarter, but overtime, and what I'm doing. So we're all familiar with how to become successful in neurosurgery. The 3 A's, availability, affability, and ability. Sometimes we forget the 3 A's of failure, arrogance, avariciousness, and an adversarial personality that sometimes we see in residents at times that need to be put down a bit. And I was very intent on being very successful when I got out of my residency at IU, recruited by Pete Janetta to come to the University of Pittsburgh. I was appointed the chief of neurosurgery at Presby, the main teaching hospital, doing profound hypothermia, clipping aneurysms, and I was named a consultant, the first consultant in the NFL, actually, as a neurosurgeon to the Pittsburgh Steelers. So very successful, in quotes, successful. And this was back a long time ago, Amin, when we were doing awake craniotomies at Allegheny General. This is back in the 80s, the late 80s, not using your technique. I wish we had it. But one day I was doing awake craniotomies. The next, there was a major train wreck, and my father died at age 60. My wife left with our 2 kids in the middle of winter because I was so bent on being successful. And I had to quit neurosurgery. So one day, I'm the chief of neurosurgery at the University Hospital. Literally the next week, I'm working in this truck stop that was bequeathed to my mother, heavily mortgaged, and pumping gas and flipping hamburgers in a truck stop. I talked about success. failure, and subsequently how I got out of it, and we'll get to that, but I had a major life quake. Bruce Feiler wrote this book. He interviewed several hundred people about the history of their lives, and he found that virtually everyone, and I can tell you everyone in this audience, has had a major life quake. You've had a child perhaps injured or die, a parent lost, a major illness in someone you love or yourself. 3 to 5 per lifetimes, at least, taking 1 to 3 years to overcome. And it was very early on that I learned that you can't soar with your successes, but you can't plummet too far with our complications and our failures. So I picked up this book when I was living in the farmhouse, very depressed, pathologically depressed, and The Secret to a Balanced Life by William Danforth. It was given to me as a high school graduation award. And this is what I want each of you right now to do. I want you in your minds or on a piece of paper, draw a square. And I want you to put work, family, social, and relationships on one side, spirituality at the bottom, and physical on the other. This, ladies and gentlemen, this really is the secret to a balanced life. And I can promise you that. Now I want you to draw a line commensurate with how much time you spend on each of these on a daily basis. How long is your work line? How long is your family and social line? How long is your spiritual line? And how long is your physical line? It should resemble a square. This is what mine looked like. It was a straight line EKG. There was all work. There was no family, no spirituality, and I was 20 pounds overweight. So what do you do in a situation like this? How do you get out of such a dark, deep, funk, depressive hole? Well, I had no idea what to do. But it wasn't a fluke that there was a mortgage on the truck stop, and the banker who held the mortgage was a friend, and he called me one day and said, "Joe, we need to go for a run." I said, "Run? I'm 20 pounds overweight. I can't walk up a flight of stairs without being dyspneic." We made it down to this track in Triadelphia, West Virginia. I made it around 4 times, and I said, never again. I was exhausted. My diaphragm was in spasm. But something very unusual happened that night. I slept for the first time in 4 months. So I went back the next day, and I went around 1.25 miles. And then 1.5 miles, 2, 3, 4, 5, and strange things started to happen to my brain and my body. I subsequently read about triathlons. I learned to swim, to cross-train. I got a bike, and I entered in a 10-man triathlon, 300-meter swim, 10K run, 10-mile bike. I felt like Roger Bannister breaking the 4-minute mile when I did that. And I subsequently started to continue the same because very different things were happening to my brain, my neurotransmitters, and my body. And I subsequently entered into I got a lottery into the Hawaiian Ironman Triathlon, which is 2.4 miles swim, 112-mile bike, and a marathon. This is the swim start here. It's just a phenomenal experience. And this is the finish. This is like clipping a basilar tip aneurysm. This is the end of the race, of course, 14 hours later. But I could watch this over and over. But anyway, I subsequently was able to maintain this degree of competitiveness and have done 8 of these and a whole lot of other races. And the point I'm telling you about this is not to boast, but to emphasize how the brain can make the body very sick. Cardiac problems, irritable bowel problems, dermatologic problems, but the body can heal the brain. Psychoneuroimmunology, it's a whole new field of endeavors. We need stress in our lives, and we need stress to a point. Hans Selye, the physiologist who wrote The Adaptation Syndrome, talks about good stress and bad stress. Bad stress is very debilitating, and you have to be able to recognize it. I was totally unaware of the distress that I was in when I was in my pursuit of success. And we all know about the hypothalamic pituitary adrenal axis, how stress suppresses the immune system and increases cortisol, increases anxiety, depression, insomnia, and a host of other things, and how stress is neurotoxic to the brain, particularly the temporal lobe. It kills cells in our temporal lobe. And stress hypercoagulability is also a major factor. When we were running through the jungle on the savannah in Africa, and we were chased by a lion and our arm got sliced by a thorn, the bleeding stopped because we were hypercoagulable. And this is a mental stress from a lawsuit, what stress does to our bodies. This is a pulmonary embolus in Dr. Brigham, who was a team doctor for the Baltimore Colts, who was sued for a non-failure, or for a failure of an anterior cervical discectomy and a prime defensive back. He was extremely stressed by this, and I defended him by a deposition earlier on. The first day of the court, when he went to turn his car on, he dropped over dead from a pulmonary embolus because of a hypercoagulable syndrome. And this is a patient that I operated on. I did an anterior cervical discectomy, a jockey who swore that I told him he'd win the Kentucky Derby the following year. And the screw in the top plate pulled out 3 millimeters, gave him a little dysphagia. I said, come back, we'll fix it, it's no problem. He went to New York, had a second opinion with an orthopedic doctor, and this is how he fixed him, with the 2-level anterior and multiple screws in back. And a lawsuit against me for 3 weeks, 3 days on the witness stand. And the jury we were to go to court to hear the verdict of the jury. I was sued for $30 million, triple damages because of negligence. At the end of my career, 76 years old. And I told my attorney, if I go to court and this verdict's against me, I don't think I'm going to make it out of court. I was thinking of Craig Brigham. I went to the hospital ER and had a angiogram. This is my circumflex artery that was 90% occluded, ready to be clotted off, had a stent, and I was on the table when the nurse came in, and I was in a fentanyl drip, and said, Dr. Maroon, I want you to know the attorney called, you are exonerated, 12-0 verdict on your behalf. And I'm thinking in a fentanyl psychosis, it's a lot of good does me now. And subsequently, 2 weeks later, I was walking up a hill and had severe claudication in my leg. I stopped, and I don't have a herniated disc. I went home, I listened to my femoral artery with a stethoscope, heard a loud bruit, and had this clot in my femoral artery. A subsequent stent the next day. I ordered the MRI myself, and this is what it looks like now. So I had atherosclerotic disease, both in my coronary and my femoral artery. The hyperviscosity precipitated out a clot, and I dodged a couple of bullets there. So we wrote a paper, Catastrophic Cardiovascular Complications from Medical Malpractice Stress Syndrome. I urge all of you to read that when you're sued soon. I'm sure 95% of the people in this room have undergone a lawsuit. That's the typical for neurosurgery. Why your DNA isn't your destiny. My father died at 60. I thought it's all over for me. When I got to 60 years of age. He died when I was 40, and I made major adjustments at that time. And it's epigenetics that's more important than genetics. 80 to 90% of what happens to us is epigenetics. And what do I mean by epigenetics? I mean nutritional, exercise, environment, and emotional health. If you eat a Big Mac infused with hormones and steroids, a pile of French fries with trans fatty acids and phosphoric acid in your Coke, you're going to incite inflammatory cytokines and cause inflammation. That's the pathogenesis of oxidative stress, Alzheimer's disease, cardiac issues, and so many other diseases. We want a healthy diet, epigenetically, nutrition, appropriate supplements, exercise, environment, emotional health, and exercise. What does that do to BDNF? It increases BDNF, brain-derived neurotrophic factor. It makes new brain cells, new synaptic connections, and enhances neuroplasticity. So why do people in the blue zones, Butner is going to be the speaker at the Congress this year, why do they live longer and where? Sardinia, Okinawa, Icaria, where Icarus plummeted into the sea. They live longer because epigenetically, their diet, they exercise by working hard, they avoid environmental toxins, and they also control stress with strong family units. So my goal was to die young as late as possible. And, we were talking this afternoon about the bullets going by. I dodged a couple already, and, I think of Justin Singer, and 42 years old, massive intracranial hemorrhage. So this is the science part. The first part of my talk was about life. I'd like now to focus on what I'm doing at this point. Somerset Maugham said, the meaning of life lies in what one wills or chooses to create. When we heard the talks we did today, just outstanding material on creativity. And Dan Barrow and Bernard Bendock just this month published in Neurosurgery, what's needed in men and women in a career in neurosurgery is curiosity, creativity, and physical stamina. You need to have a relatively balanced square to do that. And what is creativity? It's the central executive cortex, the default mode, and the salience network all working in conjunction in the right way and combined with enough dietary restrictions and exercise. So what I'm going to share with you in the next 15 minutes is what I've really gotten passionate about as an octogenarian. And the first is hyperbaric oxygen. I'm going to share some things with you about the immunotherapy of cancer, what we're doing with Alzheimer's and Parkinson's and traumatic brain injury, particularly CTE. So we've known for decades that hyperbaric oxygen heals peripheral wounds of the body. Diabetic ulcers, non-healing fractures. Very little has been done in terms of non-healing wounds of the brain. So what is hyperbaric oxygen? It's a chamber where under pressure, breathing 100% oxygen, our cells are normally, our hemoglobin is normally 98% saturated, but when you're in a hyperbaric chamber, it forces oxygen, hyperoxygenates the plasma. So you increase your plasma level of oxygen more than 17 times, which perfuses and hyperoxygenates all of your organs. There are monoplace chambers and multiplace chambers. In a multiplace, you breathe 100% oxygen under a mask in a chamber, reading on iPads if you want, and it's very effective. So this is Ryan Shazier, 6 years ago, playing against the Cincinnati Bengals, and he makes this tackle against watch his head. He hits, flex, and there you see that twitch in his back, and he falls to the ground and knows immediately, it's incredible, immediately that he broke his back. and he uses the weight of his body. He's immediately paralyzed. He rolls over, and then Roethlisberger, Coach Tomlin, grabs his head, said, "Oh my God, I can't move my legs." And he's carried off the field, taken to the ER at the University of Cincinnati, actually, had these films and showing he had a facetal fracture and a translocation at the T9-10 area, and the epidural hematoma on the left, it got bigger over the next day or two. He was immediately decompressed and fused, and he's lying in the hospital paraplegic, and I'm asking myself, what else can we do at this time? One of the first things I did was called Dr. Julian Bales. I said, "Julian, with the Sago mine disaster that he managed many years ago in West Virginia when he was chair there, he gave," what was his name, Rich? Randy McCoy was one of the lone survivors in that Sago mine disaster. He put him on 16 grams of omega-3 fatty acids, fish oil, a day. So we did that, and we also, I looked into the literature for spinal cord injuries, hyperbaric oxygen therapy of spinal cord injuries, and saw that it's anti-inflammatory. When we look at the secondary effects of a spinal cord injury, there's the initial axonomesis, and then there's the inflammatory reaction, the edema, and the vasculopathy that occurs secondarily. So hyperbaric oxygen also reduces the inflammatory reaction and promotes neurological recovery. This is a more recent paper. So we put him in a hyperbaric chamber and gave him 30 dives, twice a day actually, and subsequently, between that time, surgery, and I'm not saying hyperbaric oxygen cured him, but he was able to make a complete recovery, had a child, and is now virtually completely functional and normal. I say this because I've been working with Dr. David Fuller at the University of Florida, who is doing work now, very good work, all published in peer-reviewed journals, using HBO for spinal cord injuries and showing in a mouse rat model that acute use of HBO is very therapeutic compared to a trial trauma. So if I had a spinal cord injury today, please, after you take care of my wound, put me in a hyperbaric chamber. We're actually looking at a study at the University of Florida to do that. I just gave a talk 2 weeks ago to the National Hockey League Trainers Association on the use of HBO for healing the brain, accelerating recovery, and increasing performance. It boosts performance. And this is a paper from Dr. Amir Hadani, a neurosurgeon from Israel, and Shai Efrati, who's a brilliant hyperbaric oxygen physician in Tel Aviv at the Hadassah Hospital. And they've published, they've produced a renaissance in the use of hyperbaric oxygen therapy for things that I'm going to talk about. And they did a randomized study in athletic performance. And they actually did muscle biopsies of the gluteus maximus in a group of middle-aged, high-performance athlete, looked at their mitochondria, and then put them in 40 dives in a hyperbaric chamber, rebiopsied them, and saw that there was mitochondrial biogenesis. Think about that. Mitochondrial biogenesis, making new mitochondria intracellularly. And so I know them now pretty well, and I thought, boy, you know, I'd like to do this myself. So I literally took 3 months off, went to the villages in Florida, the Aviv Hyperbaric Center, the only one like it in the United States. They treat 88 patients a day with various things from stroke, spinal cord problems, Lyme disease, post-COVID, and I've seen the results. But I went to this study, to this clinic. I had detailed neurocognitive testing, memory, brain speed, processing of information, coordination. I had imaging, MRI, DTI, SPECT scans, and also a cardiopulmonary fitness test, anaerobic threshold, VO2 max, and before and after. And these are the results. I had a 15% improvement in my endurance, 10% improvement in anaerobic threshold, some improvement in strength, and improvement in my output, power output. I also did a triathlon before and after, as well as I did proteomics, and I looked at my proteasome in terms of the inflammatory markers in the proteins in my blood. And it was ironic that my time, as I improved my anaerobic threshold and VO2 max, coordinated with the improvement in my time in the triathlon. And this was the senior games in Florida a couple of years ago, and I came in, I was listed as coming in second in my age group, but I really came in first because the guy who beat me lied about his age. At least I think he did. So I subsequently put all the data together and published this paper, The Effect of Hyperbaric Oxygen on Cognition, Performance, Proteomics. My telomere length actually increased. And the title of the article, The Difference Between 0 and 1. So another fluke. When I was a resident, believe it or not, this is when I was a resident in Georgetown. My first year there, I was on the general surgical service, and I rotated on the oncology service, and I became terribly depressed, operating on women with the general surgeons, doing radical mastectomies, and all of the brutal things in terms of to cure cancer, and seeing women with cervical cancer that were neglected, the smokers. So I wrote this book, What You Can Do About Cancer, which was basically emphasizing the American Cancer Guidelines. But this was 68, 9, something like that, 100 years ago. But my interest was there in that, and this is a prostate cancer in top of a gentleman that Dr. Bales and I both know, that we actually recruited as a colleague at Allegheny General Hospital, who is an expert in cryotherapy for use of liver tumors and others. He developed prostate cancer at age 62. He did not want to be incontinent or impotent. He did not want a radical prostatectomy. He did not want radiation seeds, which I have seen devastate a few men that I know where they burned everything out, their rectum, their bladder. They had a radical exoneration from benign radiation therapy. Instead, he was very innovative and treated himself with cryoimmunotherapy. And basically, under a spinal anesthesia, he had a urologist insert a cryoprobe into his prostate gland and then inject checkpoint inhibitors. And that's the bottom slide where his pelvic lymph nodes disappeared, his prostate shrank, his PSA went from 200 to minus 0.06, and his Mets disappeared. 5 years now, 4 years later, he's normal. Quite an anecdotal case. So this led to a company that is called Synchromune, and basically the process is as I said, and I'm going to show you a brief video, and a cryoprobe is inserted into the tumor with CT guidance or ultrasound, cryolysis occurs, and then checkpoint inhibitors. So it's synchronizing the power of intratumoral immunotherapy. And this is, Could we have the video, please? It's the... Oh. No, it's not that one. It's the next one. No, not the next one. That one there, yes. So this is a 2.5-minute video that really...
The SYNC-T solid tumor treatment platform is designed to work within the body to synchronize immune system education and stimulation using a multi-target drug and device combination therapy. SYNC-T is an investigational, novel, personalized cancer therapy that targets multiple mechanisms to empower the immune system to recognize and destroy cancer and to defend with immune memory. Depending on the location of the target, CT or transrectal ultrasound imaging can be used with SYNC-T. SYNC-T can target both primary and metastatic tumors. Once our proprietary device is inserted into the target tumor, the first step is to lyse a small portion of the tumor. This causes tumor cells in the lytic zone to rupture, releasing neoantigens into the tumor microenvironment. Neoantigens are tumor proteins that can be used by antigen-presenting cells to educate T cells within the immune system and empower them to recognize and attack cancer throughout the body. The second step is to infuse our proprietary multi-target drug into the lytic zone. The multi-target drug is designed to reverse immunosuppression and be highly immunostimulatory. Portions of the mixture of drug and neoantigens flow out of the tumor via the lymphatic vessels into locoregional lymph nodes. This synchronizes the location of the three components necessary for T-cell education, namely the patient-specific neoantigens, the multi-target drug, and the immune system components in the tumor microenvironment and tumor-draining lymph nodes. The goal is to activate the immune system and combat immune suppression, resulting in effective patient-specific T-cell education. The third step is the expansion of anti-cancer specific T cells that can recognize and destroy the cancer throughout the body. In summary, SYNC-T is a novel, personalized cancer therapy platform that has the ability to target multiple mechanisms to empower the immune system to recognize and destroy cancer and to defend with immune memory.
This is essentially CAR T therapy in situ. The
The
body is
SYNC-T
used...
solid tumor treatment platform is designed to...
The body is used as the lab to synchronize the T cells that in CAR T is re-injected into the body, $350,000, 3 days or 4 in the ICU, et cetera. This is outpatient and virtually minimal morbidity. This is a patient, a friend of mine, who had metastatic breast cancer to her liver, failed all therapy. You can see that on the pre-op scan. She had 2 of these treatments as an outpatient, and this is her scan. And she's now about a year and a half post-injection, completely normal and doing very well. This is a urologist with 53 metastatic lesions to the spine and pelvic lymph nodes. And you can see on the right, the sagittal sections, all of those red spots are metastatic lesions in the spine. And on the far right is the post-treatment. He's a urologist, came in a wheelchair, couldn't walk because of incredible pain, is now back practicing urology. We thought, well, might this be applied to brain tumors? So we got a generous grant from a donor in Pittsburgh, and we've done 4 dogs using augmented reality for guidance to place the probe into the tumor. And through this same device and a holder, we freeze the tumor and through the same needle inject the immunotherapeutic drugs into the area, and subsequently this is a dog tumor. It's interesting, I didn't know this, but Kostas Hydropanatis is working with us on this. We recruited the neurosurgical head of a veterinarian hospital, a vet neurosurgeon, to help us with this. Unfortunately, we've not been successful in the dogs for a couple of different reasons, but what we have shown is the safety of the procedure, and the company is going to go for an IND for palliative use, and we'll see what we can do with it, because we believe that doing this, we know from the investigators at Johns Hopkins that the tumors do drain into the regional lymph nodes of the neck, where we believe immunization can occur, and with a disrupted blood-brain barrier, again, this is all theoretical, but there may be something that can happen of a positive nature with this. And I'll wrap up with something that is very exciting to me. This is Dr. Pravat Mandal. Dr. Mandal is a professor and director of the Indian National Brain Research Institute in Gurgaon, India. And because of age, at 62, 63, he had to step down. So we recruited him to the University of Pittsburgh Department of Neurosurgery, and he's an expert in magnetic resonance spectroscopy. And as you know, MRS, we can measure the chemicals in the brain. And we were able, and you also know that in Alzheimer's, amyloid plaque and neurofibrillary tangles are the underlying pathological features, and billions of dollars have been spent on removing beta amyloid plaque from the brains in patients with Alzheimer's disease. And lecanemab is the most recent drug, an antibody with a 21% AED complication rate, works in 29% in slowing the disease, costs $26,000 a year, and has to be injected every 2 weeks. What we've shown for the first time using MR spectroscopy in both Alzheimer's and in Parkinson's disease, there's a deficiency of glutathione in the brain. What does that mean? Well, we feel that we have a novel biomarker for mild cognitive impairment, MCI, as well as AD, and we've published this in Biological Psychiatry and in other journals. So non-invasively, we can measure the glutathione in the brain, and we can determine whether or not it's deficient. So glutathione is the master antioxidant in the brain. So if you put an apple out overnight, or a banana, what color does it turn in the morning? It turns brown. Why? Because it oxidizes. Our brains also oxidize when we get older. We lose glutathione, and what happens then? Well, free radicals are generated, and as you know, sunlight, smoking, toxins, other things cause the generation when our mitochondria take oxygen and glucose to make ATP, free radicals are generated. If they're not squelched, if this oxidation process is not squelched by an antioxidant, you have unmitigated damage that occurs. And we believe that oxidative stress occurs prior to beta amyloid deposition. It's the pathogenesis, it's the upstream marker that is not being targeted by billions of dollars with drug companies. So what about trauma? Well, we know that oxidative stress is a primary factor in trauma, traumatic brain injury. And it destroys mitochondria. It causes excitotoxicity, immunoexcitotoxicity, and it enhances cytokine release, the arachidonic acid pathway, and lipid peroxidation. All this occurs when there are repetitive hits to the head or even a single hit, but in particular, repetitive hits to the head. So, with that background and our interest in traumatic brain injury, So what? So we decided to submit a grant to study repetitive head injury. And what's the best population to look at repetitive head injury? Well, it's former NFL players and former Navy SEALs, particularly the SWCC operators, the Special Warfare Combat Crewmen, who drive these high-speed boats 40 to 50 miles an hour over waves 2 to 6 foot tall and get slammed every second for up to 8 to 10 hours at a time. For some of these guys have 15,000 hours on these boats. 15,000 hours. All of them, well, in the NFL players, this recent study out of Boston by Grant Iverson, 1/3 of former NFL players with RHI report perceived CTE, behavioral or neurocognitive abnormalities. In the speedboat operators, the special warfare boat teams, virtually all of them, 70% report impairment due to impact injury. All of their spines. We just surveyed 200 of these guys. 100% have degenerative disc disease, spinal stenosis, herniated discs, and spine pain. 90% of them report traumatic brain injury and concussive injuries. So basically what we're doing, we're taking a cohort of both former NFL players and Navy SEALs, and we just got a grant from the Chuck Noll Foundation to bring them in, do MRS studies. We're also looking at the microbiome. There's a huge connection between the gut and the brain in Alzheimer's, as well as in traumatic brain injury, and also look at various blood markers. Then we're not going to give them glutathione. If you recall, I'm going to take a tangent. With Parkinson's disease, dopamine is the neurotransmitter that's deficient. We're going to but they give L-DOPA or carbidopa. Why? Because it crosses the blood-brain barrier and dopamine does not. So what we're going to do with these individuals when we hopefully show they're deficient in glutathione, we're going to give them gamma-glutamylcysteine. I've been working with the scientists at the University of New South Wales in Australia for 2 years. They have synthesized or extracted from yeast gamma-glutamylcysteine. And gamma-glutamylcysteine is a precursor to glutathione. So if you look at the tripeptides that form glutathione, cysteine and glutamine, come together to form gamma-glutamylcysteine. It then picks up glycine to make glutathione. So we're going to give these individuals gamma-glutamylcysteine, which I take every day, prophylactically. And so I've covered a whole lot of ground, and I've gone a little bit over time. But in summary, think about your square on a daily basis. How are you going to get your exercise in? Touch your family, your spirituality, and your work. And how to compress morbidity into the shortest time, the things we talked about. Diet, exercise, avoid environmental toxins, try to control stress and get adequate sleep. And this is a book that I wrote, Square One, A Simple Guide to a Balanced Life. Sanjay Gupta said it's already changed him. And the three most important things in life when we get through all of this stuff, so what? You know, it's physical and mental health. So essential. Relationships with God, family, friends, and colleagues, and carpe diem. Justin Singer, myself, other people, how many people we know who, every day, this heart attack, the stroke, the intracranial hemorrhage, we don't know the hour nor the day, so seize the day. And these are two Steelers that I operated on with, both had cervical myelopathy, and I was as tall as them when I played for Indiana. But that's what happened. And then that's the long and short of it, ladies and gentlemen. So thank you very much. I appreciate your time and hope I was able to share some thoughts with you.